would you like me to address you today?
Alyssa.
That's perfect. All right, we're just gonna be doing a head, nose, and face exam. I'm just gonna start by inspecting, just checking the position of your head in relation to your shoulders, which looks nice and neutral. Checking for any skin discoloration, any hair patterns, any scars, bruising of the face or the neck area. Everything looks great. Checking for symmetry, checking the nose to see if it's nice and straight, which it is. Checking the mouth to see if it's even on both sides. The eyes to see if one's drooping or not, and the eyebrow line to see if it's parallel on both sides as well. And then also checking the hairline, which looks nice and regular as well. Now I'm going to, usually I would have gloves on for this exam, but I didn't wash my hands, so we don't have gloves, so I will just be using my bare hands. So I'll start with inspecting the hair. Just gonna kind of pick through here a little bit, just checking for any lumps or bruises, any, if you're in middle school or had kids in middle school, be checking for nits and lice, and checking for any skin discolorations or rashes that could be hidden by the hairline. And then if there were any cysts or bumps, I would push on those to check for pain. And then also just palpating the head, checking if I push pressure anywhere, does it hurt at all?
Nope.
Nope, okay, perfect. All right. So now I'm going to be checking the parotid gland, which is just going to be right on your cheeks. I'm just going to put pressure on both sides. Any pain with that at all?
No.
No, I feel about the same. Checking right here. And I'm just going to be listening to two of the arteries. One is the temporal artery and one is orbital artery. So I'm just gonna, it might be a little bit cold, but there'll be a little bit of pressure, but it shouldn't be painful.
Okay.
Just making sure it's on the bell side. And I'm just gonna place it over your temporal artery right here. So then when I come onto the other side as well, checking on this side. Perfect. Then if I can have you close your eyes, I'm just going to place this over your eyelid nice and gently. Might feel a little bit of pressure, but again, it shouldn't hurt. Perfect. And then one more time on the other side. Okay. So now I'm going to be assessing the cranial nerve 5. So I'm going to start with just placing my fingers in a couple areas of your face, just telling me if they're the same or different.
Same.
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 And then down here.
Same.
Perfect. Okay, and now we're going to assess the one of the motor components here. So I'm going to be taking, I would be using a sterile cotton swab. I didn't have those for the time, so we'll just use some regular ones. And I'm going to be placing this on the white part of your eye. So I'm going to just have you look in that general direction. I'll hold your eye open here, and then I would place this on the white part of your eye, checking for a blink response. And then I'll have you look this way. I'm using a new cotton swab. I place it on your eye, again checking for a blink response. Take a tongue depressor here, and again just going to be checking the motor component. So I'm going to have you place this in between your teeth on both sides, clamp down, doesn't have to be super hard, I have to break it, and I'll just be applying a bit of pressure just to see if I can pull it back. Perfect. And this one. Perfect. Okay. And then checking for the motor component of cranial nerve 7, I'm going to have you scrunch up your forehead, and I'm going to have you smile, and try to frown, and then puff out your cheeks. Perfect. Looks good. Alright, so now we're going to be inspecting the mouth and oropharynx area. I'm just going to be looking at your lips, checking for color and again asymmetry, any asymmetry, which they both look very symmetrical, very nice, you're good to go. Checking for any lumps, scars, ulcers, cracks in your scaling. And then, see here, I'm going to take my tongue depressor and my pen light, and I'm just going to be kind of poking around in your mouth a little bit here, just checking for, there we go, and you open your mouth nice and wide, checking the sides of or checking the gums for any discoloration, checking the teeth, soft palate and the hard palate, checking the tongue, the frenulum, checking for consistency in saliva, and again the hard palate for color and any polyps or nodules. Now place this on the back of your tongue and have you say ah. Perfect. And then be checking for the posterior pillars, tonsils, also checking for any redness or exudates. Let's see here. Oh, I'm also gonna check your gag reflex, if that's okay. So I'm gonna have you open nice and wide. And I'm just gonna reach in the back here. And also the gag reflex. Perfect. Alrighty. And yes, both. There's symmetrical elevation of the soft palate and the uvula, so that was consistent. I'm going to have you stick out your tongue now. Checking for the motor component of cranial nerve 12, 8, 9, 9, 10. And then going to grab hold of your tongue with this piece of, it would be sterile cloth, but it's paper towel for what we have. So I'm gonna have you open your mouth, just grab a hold, and then I'm just gonna be looking on the sides, and then above and below, just because this helps me see a little bit better. Thank you. And I'm gonna toss these in the trash. Alright, so now we're moving on to the nose, just checking, I'll be checking the external and the internal nose. External nose, checking for symmetry, any nostril flaring or septum deviation, which all looks good. And I'll be inspecting the inside of the nose here. Okay. Alright, so I'm using a fresh tip here, and then I'm going to insert this. I'm just going to have you tip your head back a little bit, and push up on your nose a little bit, and then insert. And then just looking for any, checking for any color changes. Refresh one and look at the other side. Check on this side. Okay. So yeah, didn't see any signs of swelling or color changes, so you should be good there. No polyps or exudates were present either. I'm gonna have you do the nasal patency test. I'm gonna have you take your right hand and place it on your right nostril. Try to breathe in and out of your left nostril. Perfect, and then do the same on the other side. Nice and clear, no allergies. I love it. Perfect. Alright, so now I'm just going to be palpating the sinus area, so right along your maxillary and the right frontal sinus. First, I'm just going to start by palpating to see if there's any changes in texture or temperature. Now I'm going to put a little bit of pressure on that maxillary sinus. Any pain with that? Okay. I'm going to do the same on the frontal sinus, just kind of palpating and apply a little bit of pressure. Any pain with that? Nope. Perfect. Then I'm just going to go along and percuss. Let me know if there's any pain. Either side? Nope. Nope. And then frontal. Nope. Perfect. Alright. So then for the final inspection, we're going to go with the neck. We're going to look at the neck. So again, I'm going to be checking the skin, looking for any lesions, scars, masses, any unusual pigmentation or hair patterning, any lymph, and then checking the lymph nodes and the trachea just to see if there's any visual deviation, which there doesn't appear to be. So now I'm going to go through and palpate the trachea looking for any deviation. So I'm just going to place my fingers right on your sternum here and go up into the trachea, which feels right in line with your sternum, which is good. And then I'm going to have you swallow for me, if you don't mind. Perfect. Again, checking for any deviation, which it all felt normal. I'm going to be checking the thyroid gland now, so I'm going to have you just kind of tilt your head back a little bit and just kind of visually looking. I'm going to use some tangential lighting here and just place it on the side of your neck, looking for any shadows. Looks good. And then again, just visually inspecting for any masses or deviation of the thyroid gland. I'm going to have you, I'm going to do another swallow test. Okay. Palpate the thyroid gland. I'm going to have you swallow one more time. And one more time. Yeah, that's good for that. Perfect, okay. And then I'm just going to be palpating my ladder, looking for any asymmetry of the thyroid gland, any swelling or nodules that are present, which does not feel like there is. So you're good there. Alright, I'm gonna go through, I'm just gonna stand behind you here and I'm gonna palpate the lymph nodes. So I'm gonna start with, let's see here. Oops. Alright, so I'm gonna start with palpating the preauricular lymph nodes here. And then moving down to the posterior, posterior. Good. I'm gonna come down to the corner of the jaw, and then for the tonsillar, and then the submandibular, and then following down to the front of the chin for the submental. I'm gonna come back and feel the occipital lymph nodes, and then following on superior to the SEM, following the superior lymph chain, and then coming. That would be the SEM. Then coming posterior, checking for the posterior chain. And then trying to palpate for the deep chain, but it's right underneath the SEM, so they're kind of hard to detect. But checking for any abnormal sizing of the lymph nodes, all feel round and small and good to go. And then also checking for the clavicular, supraclaviculars. And again, all feel small and round with smooth borders. I'm going to be listening to the carotid artery now, so I'm going to be listening, it's right on your neck here, right next to your SEM. Okay. So I'm going to take the bell end here of my stethoscope, and I'm just going to place it on your neck. Might feel a little cold. Again, this is just lateral to the SEM. And I'm going to come on the other side here. Strong. Alright, and I'm just going to be doing a cranial test again here. So I'm going to have you, I'm going to place my hands on your shoulders and I'm going to have you shrug up. Perfect, and any pain with that at all? No. And I'm going to be testing the SEM, so I'm going to have you look over to your right here. And then apply a bit of pressure, push into my hand. And then that left SEM should be firing, and again on this side, and push into my hand. And again, that right SEM should be firing. And that is all I have for you today. Please tell me that it was recording.